everyone's on board. Yeah, you can record this. Your wife talks. Guess what the note says? Someone else talked. It will identify other people. Like it's crazy. It's crazy good at doing some things, but do you really want that in your note, right? So you're still the provider still has to do a lot of parsing, a lot of oversight on that documentation to make sure when they sign that note in your record, it actually reflects what they want it to say.
Welcome to Embracing Digital Transformation, where we investigate effective change leveraging people, process, and technology. This is Darren Pulsipher, Chief Solution Architect, author, and most importantly, your host.
On this episode, navigating generative AI and privacy in healthcare with returning guest Jeremy Harris, a healthcare privacy expert.
Jeremy, welcome back to the show.
Thanks, Darren. Happy to be here again.
Hey, so we've recorded, this is our third time recording together.
Yeah.
Everyone should know Jeremy and his superpowers already because he is a superhero. But I mean, even though we live down the street, we're not recording in the same room because it's just a pain. I got it all set up for remote. So we've done in the same room before. Mm-hmm. You feeling okay doing this remote? You all right with this?
Yeah, it's fine. I mean, most of my meetings are remote anyway. So it's the rare occasion where I actually get to hang out with you, Darren. So it's fine.
Well, no, exactly.
You're busy. So it's hard to get on your calendar these days.
So, hey, today I wanted to talk about generative AI and privacy because you're a privacy lawyer. That's your specialty, especially in healthcare. But there's a lot of crazy rules and regulations, especially in the beautiful state of California, where the laws are contradictory at times on what I can share, what I can't share. And with generative AI popping up in the realm, this puts a whole new twist on things.
Yeah, I think what it really does, to be honest, is Gen AI is so pervasive. It's so data centric and data ravaging, right? It just takes all sorts of huge, it just consumes all sorts of data. It scrapes from everywhere. I mean, ultimately, what we see is in the privacy conflicts that happen with Gen AI. I think they rear their head the most probably in the healthcare sector. I mean, maybe in the financial sector as well, where it's heavily regulated, credit card information, that type of thing. Banking, I do think there's some regulation there. But healthcare, it's a pretty significant ask to deconflict AI and truly helpful generative AI and the privacy side of it. So, yeah, I think it's a huge problem.
You said something really interesting there. In the financial markets, Gen AI may help a little bit, but that's numbers. In the healthcare, in the healthcare system, we're talking a lot of unstructured data. We doctors' notes or nurses' notes, or there's a lot of unstructured data there that this is perfect for Gen AI to actually help people.
Sure. Yeah, and I've seen it. I've seen it in my own practice and my own companies where I'm working with. I looked at, let's look at how about a chatbot. It's on the webpage, right? You log in and all of a sudden there's a chatbot that says, hi, my name is so-and-so, whatever, Dottie. I'm your new chatbot assistant. Tell me all your problems. And it's like, oh, okay, really? Are you going to trust that chatbot with your mental health history? Like that's mind-boggling to me.
Absolutely. I will if it helps me feel better.
And you might. And there are ways to do it, right? And that's my point is I don't want anyone to come in thinking, oh, well, he's just the privacy lawyer and you can't do AI. You can do AI. I just don't think that the regulatory framework around what we're doing as really worldwide, globally with AI regulation, it hasn't caught up to anything that we're actually trying to do with the technology. All the AI startups are trying to do some fantastic things. I mean, a chatbot just one of them, right? Triaging. You got documentation, right? Exactly what you said with notes. Right now, you can walk into a doctor's office here in my town or in our town, right? And you walk in and they hit little record button and say, hey, this is what we're doing. Now, that's complicated because it's not actually an AI or privacy related.
No, it kind of is because... Right. I mean, that data. Because that just happened to me recently. I went to the doctor, says, hey, we're going to use Gen AI to transcribe our conversation, so those go into your notes.
Yeah.
Is that
Yeah.
okay? They asked me.
Yeah.
Me being
Well,
the
and
Gen
that
AI
part of
guy,
it,
I'm like, of course,
right,
right?
right. And that part of it isn't necessarily a HIPAA or something that's really long, long time ago. That's, well, it is actually an old law. It's the wiretapping type of things, right? It's the two-party consent or the all-party consent type of state. You wouldn't
Yeah,
have
but
that in other states. They just record it, right? In California, they have to get everyone on board. But that data, right, that raw recording of the conversation is now going to a third party. that
right,
third
that's my
that third
point.
party vendor parses, runs through their models, right, and kicks back out a draft note highlighting, summarizing the interaction that you had in the physician's office. So let's say your wife happened to be in the office with you. Everyone's on board. Yeah, you can record this. Your wife talks. Guess what the note says? Someone else talked. It will identify other people. Like it's crazy. It's crazy good at doing some things, but do you really want that in your note, right? So you're still the provider still has to do a lot of a lot of parsing, a lot of oversight on that documentation to make sure when they sign that note in your record, it actually reflects what they want it to say.
Okay, so I want to get back to the third party thing
Yeah,
because
right.
maybe people don't understand this. There is technology to keep that all private, like like a AI PC can keep that private.
Mm-hmm.
But most of the tools out there today are using generative AI public, which means I'm streaming either text or audio out to a public Gen AI,
Right.
right? Where my data is now in the public, right? What kind of responsibility does that public Gen AI have to keep my data private? For example, they get hacked, and all of a sudden, my mental health, because I was meeting with my neurologist or my
Yeah.
psychologist,
Yeah.
all of a sudden that is now in the open. Someone can blackmail me with that information, possibly, or or employers can find that information. It's in the public. It's now in the public.
Right. And I mean, the reality is, as of right now, you have a few states that say, hey, here, we're going to regulate some AI. We're going to have a more broadly general AI regulation process, right? Utah passed an AI rule a couple of years ago. I believe Texas just signed one this last week or two. They signed one. So I think you have 3 or 4 states now that have a more overarching AI governance, AI policy approach. The federal government does not have one. So let's take, you're in California, you're talking to your psychologist, you have this going on. Well, there's some privacy right issues that you may have if you want to go down that road to claim against anybody. But the reality is, you said it was okay to record it. It gets leaked somehow. That third party doesn't have any real sense of or legal obligation to keep that very secure, because they're not, if you haven't gone through the right steps, they're not subject to HIPAA. They're not subject to all sorts of regulations that may prevent that from happening. So all of a sudden, you kind of have a problem, right? Now, if it's personally identifiable information, you might have an argument that's covered under the CCPA, right? The California Consumer Privacy Act. You might have that, but my guess is, if it's PHI and they're treating it like PHI, the companies are going to say, well, we're not really subject, that this data set isn't subject to CCPA. So it's kind of a gray area where you're going to actually have any recourse about that. So you're right. It's out there. It's in the public, and you might not have any recourse whatsoever to deal with it.
So as a patient, it's good for me to understand that that data
Right.
is possibly in the public domain now,
Right. Then the
right?
good news here, let me step just one step further though. The good news is, I have yet to meet a doctor, and I've talked to a lot of them, who are willing to use it in that setting without going through the proper hoops to make sure that there are contracts and coverage. They don't want to have
They
any
don't.
liability. So I haven't set, like, I was talking to a chief privacy officer of another entity. They use a slightly different company or different company to do their ambient recording. But it's the same idea, right? We've had conversations about, how do you do that? You have to get consent. Then you just have this, how long is it stored? All these things. And you get that under contract. So then they're bound by HIPAA. They're bound by some of those regulations. I haven't been in the case. The bigger fear that I have isn't that. The bigger fear I have is you have a well-meaning doctor who's like, "Hey, ChatGPT or I mean any of them, right?
Yeah,
Can
Gemini or
can do
whatever.
this, right? I mean, I'm not going to single out anyone, but MedPal, for instance, MedPalm. That's one that's specifically on the medical side, and that's a Google product. You're looking at these things and it's like, well, I'm just going to upload this into my personal public use version of that because I'm sitting here in the office and I'm like, hey, I want to know. And you do it, I'll upload a file, put a spreadsheet out there because I want to see the trends of all my patient load. What's going on with my diabetes care? What's going on with, high blood pressure, whatever it is. You're throwing in all of this information into, then you get to your scenario that you're at, right? Then it's a public domain. There may or may not be any controls over how they use that. And there may or may not be any controls of how they're training and utilizing that on their own model, right? So if you have a memorization problem, you could actually coax that AI to give you that re-identified information on the back
Oh,
end.
there's actually a case on this data leakage case with
Yeah.
Samsung.
Yeah.
Right? Samsung engineers used ChatGPT. This was a
Yep.
couple of years ago to summarize notes that they took and call out action items on some new intellectual property they were working on. And I'm not going to say which one, but it leaked that information when someone prompted it a certain way.
Yeah.
They got the latest and greatest stuff coming out of Samsung that wasn't even released yet.
Right, and there's a case actually where it was a researcher, fortunately not a bad actor, but who knows? But the researcher was able to get that LLM to actually give the actual discharge summary from a patient's visit to a doctor. So
Wow.
it can happen. And it because they just give synthetic prompts. Even it wasn't really even a very targeted attack, but they got an actual discharge summary, which will have sensitive information potentially, certainly protected health information, right? So,
Right.
I mean, so you do have an environment where the technology is moving at a rate that far surpasses any of the pre-existing privacy regulations or frameworks that were contemplated. I mean, you got to think HIPAA's 1996. Now it's been amended twice. High tech came along in the early 2000s, but you're looking at a law that was really made for filing cabinets, right? Not
Not.
this. So you're looking at that going, there's some things going on there that it will take a little bit of time to get to.
So do you see them revamping HIPAA completely?
I don't know that they're going to completely revamp it. What I think will happen is they'll start shifting and looking at it from a more of an algorithmic rather than a data set, right? So if I can combine things to identify or re-identify, they'll look at it from that perspective and then come out with. They'll probably follow NIST standards. Let's be very honest about this. That's a federal
Okay.
government kind of and I don't blame them. I mean, NIST is a great framework to follow. But it's a beginning point, right? It's a baseline.
Right. That's a good starting point.
Yeah, and I think they're going to follow that type of idea where they define it, they define AI, they define generative AI, they define the inputs, and then they start crosswalking between the privacy security rule and a NIST cybersecurity standard, and they kind of pull or reference or just incorporate by reference, the NIST standards for cybersecurity to say our security rules looking more and more like the NIST rules. I think that's so. Is that an overhaul? Sure, I guess it is. I
Yeah,
don't.
yeah, yeah. It would be,
Yeah,
but they could
I
say
but I don't
NIST
think it's going to be
HIPAA
in a
or
vacuum, right? I think the federal government is going to look around and say, we don't want to create this all in a vacuum. And every agency is going to do what they want to do and have it defined differently. I really do think that they want to have some sort of unified approach to that. At least that's the direction I see the current administration trying to go. But then again, I think the current administration really wants to see where AI can go. So, there's a
well, so
discussion.
so that brings up the next question I have, especially for healthcare organizations. I could be very draconian and lock everything down and say no public Gen AI whatsoever. We'll house our own private Gen AI so the data is not leaking anywhere. I have
Sure.
tighter controls over the data. However, the the cost benefit, the benefit versus risk, where do I draw that line, right? Is it
Yeah,
okay if I'm like, well, you know what? Maybe I'll get sued. Maybe someone's data gets out there and I get sued, but I'm going to save so many more people's lives and I'm going to cut my cost and provide better healthcare for more people. Is that worth a $10 million lawsuit or a $150 million class action suit? Is that
yeah.
are they talking at that level in healthcare
I,
or
I think some are. I think right now the big conversations on how it can streamline and save on. I think more of the focus is right now on the administrative side, like the scheduling, the triaging, the the note taking, right, and how you get that in front of the provider. It I think the big care model right now that I've been talking about a lot would be radiology. Since AI, I mean, it's made on pattern recognition,
oh
right?
yeah, this is
I mean,
perfect
that's
for
what it does.
radiology.
It
Yeah.
predicts. And so if you train an AI model on radiographic images, mammograms, X-rays, whatever that looks like, right? And mammograms is a great example. If you train it on the same person's mammograms year after year, and you can actually see, and it will identify differences or subtleties that we really don't have a great eye for as people. But it can now predict, hey, this right here, this spot on the mammogram, you can see that looks like. Now I'm going to compare it to the millions of other mammogram models that or the millions of mammogram images that I've looked at. It looks like it's looking more and more like it's a pattern. It's going to lead to some sort of cancer, some sort of cyst or growth, whatever that is. And it's a really good product. I mean, Gen AI is a great, and it's really
It's
not
really
creating anything at that point, right? That's just the model, the learning, but it's a really good tool to look at those types of things and have early prevention. So I do think there are people who are talking about, like you just said, this is going to save lives. This is going to be great. I think a lot of the CFOs are looking at it saying, how can we cut costs on the administrative side and be more efficient? The doctors are looking at it like, hey, how can I actually do more with less
can I
time?
see more patients? Yeah.
And
And
it's an
spend time
interesting.
with the patients instead of charting
Right. So,
afterwards, right?
so you go to that your example again. We're back with you in your psychologist's office having a conversation, and he's just looking at you like we are having a conversation, not turn like this. Oh yeah, Darren, that's right. And he's typing the notes, right? He's actually looking at you and having a conversation. Sometimes I think that can be a huge benefit, right? That interpersonal and that interaction can be a really big benefit, especially on a psychology or a mental health. I do think there is something to be said with that eye contact, that looking to say, hey, that doesn't sound quite right. And now I'm looking at you to watch your cue. Let's delve into that a little bit more.
I'm glad you brought that up because what it shows me is that we're bringing the human back into some of these services because it's sometimes it used to be that a doctor would sit there with his notepad and take a couple notes and then hand that over to an admin or a secretary to then try and figure out his scribbles and
Right.
put that into a filing cabinet somewhere and whatever. Then electronic records came and business guys started running hospitals which said, hey, a doctor doesn't have an assistant anymore. Now they have to type in all the notes as they're so and we became a slave to the technology in some respects. Electronic health records, we want them all in there because there's so much benefit than
Sure.
just
Sure.
paper. But now we can move back to my doctor, like you said, looking at me square in the face and saying, have you been cheating on your diet? And me going, oh no, no, not at
Yeah.
all.
Yeah. It's a lot harder to lie to someone when they're looking right at you, right? if they're like this, if they're like this and not looking at you, it's a little bit easier, right? Because again, it takes that person out of it. But I think that's one of the things that the doctors are saying is the electronic health records or electronic medical records, which I usually call them EHRs, health records, but EMRs, same thing for our purposes today. But we're looking at it, you're like, hey, look, this record set is drop downs. It's smart phrases. There's a lot of rote things that you have to do, right? The health, the physical.
Yeah, that's all gone
Yeah, the
with Gen
history and
AI.
physical stuff. You're looking at that. The MA is doing all that work, or a nurse will do all that prep in terms of the doctor comes in. they don't have any more to do. They might actually turn, and I had this happen where the doctor was not yet using AI, and I said, "Hey, do you want to try it? Let's like," and I was the one saying, "Hey, let's do this," because I know my health system was utilizing it, my doctor was not, and I said, "Let's try this out." And he's like, "Well, everyone I talk to, some love it, some don't." I said, "Okay, well, let's get to a comfort level for where you think you want to go with this." And so he said, "Okay," and he had the app installed already on his company issued device. So, I mean, we had some security that I felt pretty comfortable about. I'm like, okay, this is what we're going to do. So he hits record and he's like, yeah, that's pretty good. And he looks at the note after the meeting. It takes seconds, right? I mean, the note appears and
Right away. Yeah.
he's reading it with me. And he's like, well, this is pretty good. The, the phrasing isn't quite right. And I said, well, guess what? You get to train it to your voice. Now that you're a user on this line, you get to actually train it, and it will take that reference when you modify things. It will remember how you modified it and the language choices that you use, the word choices. If you have language that is not your native language, you can actually have a note translated into another language using all the appropriate medical jargon, right? Okay, that could be really helpful.
Oh
Again,
yeah.
oversight is key, and I think despite the regulatory gaps, like HIPAA, like I said, it's an old law. There are gaps in our regulatory framework. There are gaps in how we use the data, right? AI is generated, and I get back to my first point. AI is so rapacious, right? It just
Oh yeah.
sucks data everywhere, and the one issue with that is you need someone to have a voice of reason of how it's being applied. So the providers will always have a job to look at the data, to utilize the tool just like they utilize any of their other diagnostic tools and say, hey, this is the course forward based on medical judgment, based on my license. I don't see AI supplanting a doctor, at least in the next couple of years. Really, and I don't see it because it's not licensed. It doesn't have a medical license. It doesn't practice medicine.
No,
And
it
in
doesn't.
fact, in California, the Attorney General's office came out with a couple of different statements and said, we just want to remind everyone that privacy rights and all of the information security and privacy regulations still apply to AI development. So be aware of that. And then the next statement was a separate issuance for just healthcare providers. And in that, it's very clear that the AG's office will not tolerate any sort of AI making healthcare decisions without oversight, without that human interference. So,
Well, I'm glad.
so
I'm
there
glad
are
that
some
we have
things
that.
going on where they recognize that it's a tool. They recognize, especially in California, where you have, I don't know how many startups right now working on AI tools,
Yeah, it's
and a lot
amazing.
of them in the healthcare space. But there's some great uses that I was just actually reading up on a couple of different uses for generative AI in clinical trials. They can simulate clinical trials for the for the drug development. So your R&D costs for drugs, for useful drugs, go
Go way
way down,
down.
and the time to production goes way down. Now, I don't know if it's 100% the same results yet. I
Oh,
don't think we
probably
have
not
that data,
100%,
right? We
but
don't have that data. But if it's safe enough, then again, I think those are the discussions you have to get back to your actual question. Yeah, we're saving a lot of people's lives, and we're able to offer this drug at a reduced cost because we didn't sink $5 billion into R&D. We only sunk 5 million or 500 million, whatever that number looks like, but it's drastically reduced. So you have a lower cost of entry, you have a lower timeline to get to the market. There's some great things that AI can do for healthcare, and the privacy aspects of it, while not well regulated at this point, can be managed, but the duty actually ends up falling on the data controller, for lack of a better term, right? The data owner. GDPR would call
well,
it a
is
controller or a
that data?
processor, right?
So does that put a lot of pressure on privacy lawyers like yourself to educate doctors on where the boundaries are on this?
Clearly,
That
yeah,
because I mean, it's an incredible tool. I can imagine that every doctor would want to use it to help, right, their patients decrease their workload, bounce ideas off of, all these things, and make a smarter Gen AI for medical. Can sharing information across multiple regions across the world could be incredible for healthcare across the world.
Yeah, it accelerates, right? I mean, AI is a great accelerator of all
Yeah,
of what you just
that's the
said.
right way to put
That
it.
that's how I look at AI. It's a tool. It's the next generation of tools, but it accelerates. Two good things about that. One, like you said, you can share that information and that data almost instantaneously. The models can pick it up. Now, again, models lag. I mean, they're not up to date current with the
No,
day
but
to
pretty,
day.
pretty darn close. A lot
But
closer than
right,
waiting
but
for the Journal of Medicine to come out, 6 months
yeah,
from now on my
yeah, it's a
research.
lot. It's a lot quicker than a peer review, and you have to subscribe and you have to get this and ingest this data. So it's a great way to share that information. There are, and the other good thing would be exactly what you were talking about the accuracy can be heightened, right? The ability to practice medicine can actually be improved with insights that we normally wouldn't have gotten in the past. I can throw my whole medical history. The AI can look through and say, hey, based on all the medical history, I can see patterns emerging and equate X, Y, Z all together in a chain that normally wouldn't
I
happen,
would never see. Yeah.
right? And so there's case studies about, hey, I had this issue, I wasn't ever diagnosed, and all of a sudden AI diagnosed me, and now it saved my life. I've seen stories like that. You've probably seen news stories like
Yeah.
that. It happens. I don't know that it happens
But
every
but yeah,
day,
but there's
but
still a doctor. There's still a doctor, a subject matter expert, a
mhm,
health doctor, right? That's still leveraging these tools,
right,
right? To
right.
say,
I'll challenge you on one of those things. Is I know some doctors who never want to use it. Um, One, it's usually because they're the ones who are more established age wise,
old. Just use the word old. You're such
practice wise. They are
such a
more.
lawyer. You don't want to use the real term. They're
They're just about
old.
as old as you. It's fine.
I
I
know
won't.
I'm old.
I
I'm
know,
old.
but see, you're embracing the digital transformation, and a lot of
Well, yeah,
doctors won't.
that's the name of my show,
Right? Come
Jeremy.
on.
I have to.
I know. I kind of threw that in there, Darren. I mean, come on. But a lot of physicians won't do that, right? They're nervous about, and for good reason. I mean,
I understand that.
your show probably won't get you sued if I just go off on the tangent about AI. A
Right.
doctor using AI might get sued for not really seeing things or malpractice. They could see stuff like, again, it's a different environment, right? It's heightened environment when you get into the medical realm. AI creates some unprecedented, I think, privacy challenges because of how it does this, right? PHI is such an immutable data set in the financial sector. I have a credit rating, I have a mortgage, I have credit card numbers. Something happens to those can be replaced, right? I can get a new
Yeah,
number.
but you can't replace. You can't
I can't
replace.
change my medical history, right? It is what it is. And so what happens is we have this idea that I didn't diagnose something for years, and then AI comes along and diagnoses it. What am I going to get in trouble for using AI just to tell me something that I should have known? Again, that's a real fear, and I understand that fear. And so my job as an educator, my job as a counselor would be to talk about the benefits, pros and cons, right? Of course, yeah, there are some risks, but there are risks if you're not using it as well. It's not that you don't use it and all of a sudden you're safer, right? And from a privacy perspective, and that's
No,
just
in
medical
fact,
mal.
do you see the inverse of that possibly happening? Where, hey, if you would have used AI, you would have saved this person's life, but you're afraid of it.
Yeah, I think you're going to see. I haven't seen it yet, but I think you're going to see some wrongful life, wrongful death type of suits on either way, right? Hey, if you would
Yeah,
have,
interesting.
I threw this person, my significant other died, but I ran their chart through Chat GPT, and we should have caught this months ago. Whatever it is, I
Yeah,
can
yeah.
see that becoming a cause of action, sure. And the medical malpractice world, where I don't practice a lot, that's a reality, and they can deal with that from the
What a
privacy.
nightmare! What a nightmare to be a doctor. I mean,
Yeah,
it,
there's some
it,
real challenges there, right? I mean, there's
yeah.
some legitimate challenges to say, how do I use it? Because you're kind of on the fence whether you want to use it. Well, there are risks either way from a medical standpoint, from a malpractice standpoint. From a
So,
privacy standpoint, there are risks either way too, right? Because as of right now, we don't really have a framework for much transparency, auditability, right? Are we auditing this? Are we deleting it? Right? The new thing in privacy, right? GDPR kind of did this a
yeah,
lot.
the right to be forgotten.
Right, the CCPA thing, I call it a thing because I'm still upset with how they went about passing it. But you have these frameworks, and it's not just those two, and then there's several others out there, Washington and Tennessee and whoever. There's a lot of them. But as you look at it, the right to be forgotten, the right to delete, the right to correct. What happens when all of that information is ingested into an AI model that trains on the potentially the wrong data? Then you want to correct it, but how do you do that,
You
right? How,
can't
how do
back
you
on.
get
Yeah, you can't go and just take one thing out of an
yeah?
AI model. It's just a bunch of numbers.
And the auditability and the transparency, right? That's the one of the latest things, and I know the EU AI Act, which is kind of a companion to the GDPR. They are looking at saying, hey, there's sensitive categories, there's different categories, and if you use that data, you have to get very specific consent. Well, that's great, but okay, that go along with that is this idea that hey, we should have a transparent model of how we're utilizing this data, right? What consumer understands the model?
No, well, even the guys that develop the model don't really
Right.
understand
I
it.
mean, I get the point that we want to be transparent, and I can use that word just like any other industry speaker, right? Say, oh, we need transparency. I don't even know what that means as a consumer. Like I'm looking at me as a patient, going, hey, can you tell me, can I see the AI model, please? How it's going to ingest my data and analyze it on the
Of course, you're
matrix?
not going to do that.
I'm like, okay, there's not a lot of transparency that actually comes out of being transparent. So even the buzzwords about regulatory gaps, right, that we have, I don't know what they look like from a consumer perspective. From a council perspective, I'm looking at saying, well, we better be able to describe the role of oversight in the model. We better be able to describe how our governance, and we talked about this last time I was on your show about the policies, right? And
Right.
generating some policy statements and some governance. We better have a governance council or governance committee or governance body, whatever you want to call it, that actually is functional, that actually does report out to the board, that does report out to the leadership and say, hey, this is what we're doing. Here's how we're effectuating all of these changes, because AI just keeps slapping everybody, right? I mean, you get all of these requests for people to come on your podcast.
Right.
I get requests for people to utilize a different AI model or a different AI product every day. Like it's like they just come. And I'm like, well, we don't really want to have 400 different AI products approved in our database, right?
Right. Because
So,
that's a nightmare for you to understand vulnerabilities in the models
right.
and all
And the
that stuff.
vendors, like we spoke about before, the vendors usually, in my case, in the healthcare world, the vendors usually aren't covered entities or even business associates to be subject to the HIPAA controls. They're just out there. They just do their thing, and they don't really want to sign in those contracts to accept any of that liability. Which, if I were their counsel, I would understand. I
I
get
wouldn't
where
want that either.
they don't want to go there, right? So from the framework standpoint, it's a really interesting problem, and that leads back to your point about education and training and using AI appropriately. Well, we have a bunch of tools. Well, we have a contract with Microsoft. We utilize their products. So, Azure, the cloud-based, all of that information is there. We have a Copilot contract. So all of the licenses we have with Copilot are going to be on a closed system. They're going to learn from your, Office, the Office suite
Right.
etiquette, the
Yeah.
Office
They
suite
learn
things
from
that,
your
yeah,
stuff.
the data that you input. They're going to learn from that. They're going to know your trends, your calendaring. I mean, it's interesting. I get an email now and it says you rarely get an email from such and such. I'm like, okay, I didn't really care, but thank you, Copilot, for telling me that this
Yeah,
is a
yeah,
unique
exactly. It's
email.
still it's trying to figure out what's valuable.
Right.
So, Jeremy, the big question I have for
Yeah.
you: would you see if you had two doctors? right? Let's say they're cardiologists, because you know about my heart situation.
I
If
do.
I had to pick between two cardiologists and one was using Gen AI and one wasn't, would that be a distinguishing factor for you personally?
Um, I I like Gen AI in the healthcare. I mean, I don't know if
All
it.
right,
So
counselor, you did not answer my question. That was a
of
direct
course I didn't.
question.
Of course I didn't. I Because you didn't give me enough facts. I mean, that's always the question, right? If that question right there, would it be a distinguishing factor? Yes, it would be a factor. I don't know that it
Okay,
would. I don't know that it would make the. It wouldn't be the only factor. I'll
the
have
only
to say
factor,
it that way, right?
but it most definitely
But it's a
plays a part.
favorable. I think it's a favorable
A
factor, and I think a
favorable.
lot of
Okay.
people should treat it that way because the healthcare practitioners and the healthcare industry that I have been interacting with for the last 20 years, 15 years, there is a lot of we want to do good. We want to do all the best we can. And these tools, I think, are going to be useful in large part. Do I care if my note is actually generated by AI?
No.
Not really. I've read the notes. I've actually looked at the output, and some of them are great. Some of them are actually more human sounding than the doctor's notes, which just sounds very robotic, right? Because it's a repetitive.
Right, right,
You
right, right.
and this is the type of thing. After the day is over, they might have even gone to a kid's baseball game and then do it at night. They're writing notes, and it's just like very matter of fact. The AI actually injects a little bit of a personality into it, which is sometimes kind of refreshing to read these notes. So there's some good things, but at the same time, it comes down to that interaction with my provider still going to have to make those decisions with my input, with AI's input. Why would I want less input? That's kind of how I see it.
No,
So
no,
if I
no.
had to choose, I'd say, yeah, what are you doing, and have a little conversation. But I usually go that route. Yeah.
All right. So, Jeremy, this has been great. We are out of time. If people want to reach out more and learn from you more about, this area, this is a fascinating area for me. How do they get in contact with Mr. Harris?
Well, they can look me up on LinkedIn. I mean, that's probably the easiest way. I actually haven't created a website or done any of that at this point. I'm not as advanced as you, but I could probably use some AI tools to do that pretty quickly.
Well, yeah, your AI tools or your daughter, who is a
Yeah,
web
that's probably
designer,
true as
right?
well. She'll do the design and actually she'll put it all together for me. But right now, LinkedIn is the best place to reach out. I haven't
Cool.
been active. I haven't posted a lot there, but my new resolution is, since I'm in a transition mode right now to do other things, my resolution is to be much more engaged. So that way. So yeah, they can reach out that way.
That's awesome. Hey, thanks, Jeremy, for coming on the show. I can't wait to talk to you again when we find out more information on this crazy new world that we're living in.
Yeah. Yep. Sounds great. Thanks, Darren.
Thank you for listening to Embracing Digital Transformation today. If you enjoyed our podcast, give it 5 stars on your favorite podcasting site or YouTube channel. You can find out more information about Embracing Digital Transformation at embracingdigital.org. Until next time, go out and embrace the digital revolution.